Hi, this is Vaishnavi of second year medical student. So I am going to perform a test on you. Is that okay with you?
Yes.
So I am going to test the sensory and reflexes. Uh, is that okay with you?
Yes.
So can I know what's your name
Sai Pratik.
and age?
11.
Mm.
Assessing pain sensation in arms, legs, and trunk. Do warn the patient. Then use the sharp end of the cotton swab. Test the scattered areas in symmetric pattern on the both sides. Compare between sharp and dull ends. Prepare a cotton whisk and ask him to close his eyes and ask him to respond whenever he feels it. Do it in a symmetrical pattern on the both sides of the body. For this test, take a low pitch tuning fork, vibrate the fork with your hand and place it on the head and trunk and leg. Ask the patient whether the sensation stops. Also move fork to trunk to see it is perceived. To test the position, hold the big toe with your thumb and index finger and avoid touching the other toes. As the patient close the eyes and identify the direction of the motion, repeat this several times on each side, which is irregular sequences. Repeat on the other side of the foot and also sense the upper extremities as well as metacarpopharyngeal joints. Graphesthesia, it's a number identification method. Close the eyes, use a blunt object to write on his palm. See whether if he recognizes it or not. Try it with multiple letters or numbers. 2-point discrimination. Using the ends of the pins, test the patient's fingers simultaneously at one point and ask the patient to identify, make sure he doesn't cause pain, and reduce the distance between the 2 points of pins and ask him to identify. Ask the patient to close his eyes and touch a point on the patient's skin and ask him to open eyes and locate the place where he touched. This test is used for locating sensory loss of trunk. Use your fingertips to provide simultaneously on either one area of the patient's body on in two areas simultaneously. Patient must understand whether your simultaneous was one side or both sides. Begin with deep tendon reflexes by testing the biceps reflex of the patient arm. Must be relaxed, partially flexed at the elbow and positioned with the palm downwards. Depress the biceps tendon with the thumb or index finger. Strike the thumb or index finger briskly. Now see biceps muscle contract and see flexion for the forearm. And now repeat the same procedure on the other side. And now for triceps reflex, elbow with the palm toward the body, pull the arm slightly towards the chest to strike the triceps tendon for the contraction of triceps muscle and extension at the elbow. And now for the brachioradial reflex, the patient is ready to strike the radius 1 or 2 inches above the wrist. Observe the flexion and supination of the forehead and repeat the same for other. Locate the patellar tendon with the patient knee flexed briskly. Tap on the tendon just below the patella. Note the contraction of quadriceps and look for the quick extension of the knee. The anterior thigh let you know that to feel the reflex, and now supporting both knees at once. Allow the axis of the small difference between reflexes of each knee. Tap briskly on the both knees. Have the patient in sitting position. Now dorsiflex the foot at the ankle and ask the patient to relax. And now strike the Achilles tendon. And now watch for the plantar flexion of the ankle and note the speed of relaxation of the muscle. If the knees and ankle reflexes seem to be hyperactive, test for ankle clone. Support the knee in slightly flexed position and with the other hand dorsiflexed and plantar flexed the foot a few times. Now look for sustained rhythmic oscillations between dorsiflexion and plantar flexion. In the most people, ankle does not show clones. A few clonic bleed may be felt with the patients tensed or exercised. Make sure patient in lying position. Test slightly with the pointed end of cotton swab each side of the abdomen and about T8 to T10 and below T10 to T12. Now see the contraction of abdominal muscles and sometimes elevation of umbilicus towards the stimulus. Use an object of wooden end of applicator stick or handle of the reflex hammer. Stroke the lateral aspect of the sole of the foot from the heel to the ball carving medially across the ball. Some may have uncomfortable use lightly provides the response.